Colorectal cancer is one of the most preventable cancers, and yet it's still one of the most common. That disconnect is exactly why the American Cancer Society updated its colorectal cancer screening guidelines in 2026. Not because screening doesn't work, but because not enough people are doing it. Here's what matters. Colorectal cancer usually starts as a small growth called a polyp inside the colon or rectum. Most polyps are harmless at first, but over time, some can slowly turn into cancer. The key word here is slowly. That long window gives us a huge opportunity to catch problems early, or even remove them before cancer develops. When colorectal cancer is found early, survival rates are extremely high. When it's found late, treatment becomes much harder. So what changed in the new guidelines? First, the starting age stays at 45 for people at average risk. That's important because colorectal cancer rates have been rising in younger adults. Screening continues through age 75 if someone has a life expectancy of more than 10 years. After that, decisions are individualized. But the biggest shift isn't the age, it's the options. For years, colonoscopy was seen as the main path. And it's still considered the gold standard because doctors can find and remove polyps in the same procedure. It's typically done every 10 years. But the updated guidelines expand non-invasive options to make screening easier and more accessible. There are now next-generation at-home stool tests that look for DNA, RNA, and blood markers linked to cancer. These are done every 3 years. There are also yearly stool tests that look for hidden blood. And for people who absolutely decline other screening tests, blood-based screening tests are now included as an option. These look for tumor DNA circulating in the bloodstream. They are not as sensitive at finding early or precancerous lesions, which is why they are considered a backup option. But they provide another pathway for people who might otherwise avoid screening entirely. No matter which test someone chooses, one rule stays the same. If a test comes back positive, a colonoscopy is required to confirm and remove any suspicious tissue. And that brings us to the most important message. The best screening test isn't necessarily the most advanced one, it's the one that actually gets done. The 2026 update reflects a public health reality. Many adults, especially those between 45 and 49, still are not being screened. Offering more flexible, less invasive options may increase participation, which ultimately saves lives. Screening isn't just about finding cancer, it's about preventing it entirely. And that shift from detection to prevention is what makes these updated guidelines so important. Leave us a comment below, letting us know what health research topic you want us to cover next. Give us a like if you learned something new and subscribe for more health research news.